everyone. Thank you for joining us and welcome to today's webinar, which is the fifth of our Work From Home series. My name is Corey Jameson, and I am the Public Relations Coordinator at the Canadian Institute for Safety, Wellness, and Performance, which is hosted at Conestoga College's School of Business. Our Work From Home webinar series aims to share the knowledge generated through two of our large applied research projects. We hope to help organizations recognize the challenges of work from home arrangements and provide guidance on evidence-informed strategies to protect workers' health and well-being while improving their productivity and performance. In this webinar, we will discuss the impacts that working from home has on work-life and life-work conflict. The webinar will highlight important findings from a nationwide work from home survey and a follow-up study conducted by the Canadian Institute for Safety, Wellness, and Performance, which was aimed at examining the impact that work from home arrangements have on mental and physical well-being. We will also share some insight about a recent study conducted by YMCA's WorkWell group. Our speakers for today's webinar are Dr. Amin Yazdani and Dr. Kate Toth. Dr. Yazdani is the director of the Canadian Institute for Safety, Wellness, and Performance. Dr. Yazdani uses a multidisciplinary strategy to develop innovative approaches to prevent workplace injuries and work disability at the organizational level. Dr. Yazdani's research interest focuses on standardization of human factor and ergonomics in the design of products and work environments by developing best practices and technical standards. Dr. Kate Toth is YMCA's WorkWell Director of Learning and Development. Kate's qualifications and experiences are matched with her passion for connecting with leaders and their teams to help them gain the skills they need to foster healthier workplaces. Kate is armed with a PhD in health psychology, a Master's of Science in industrial organizational psychology, is a certified human resources leader, and has more than a decade of industry experience as an HR generalist and manager. In addition, Kate brings 14 years of post-secondary teaching experience in the human resources and health fields, and over a decade in research on mental health at work to the CISWP team. The format for today's webinar will be a presentation from our speakers, and then there will be time for a Q&A session. If you have any questions during the presentation, please use the Q&A function of the Zoom platform to ask them, and we will get to them near the end of the webinar. I will now hand it over to Dr. Yazdani to begin the presentation.
Thank you, Corey, and welcome to today's webinar. At the beginning, I just would like to thank Dr. Toth for her time to join us for today's webinar. We try to discuss with you the results of our national survey that we conducted last year, and a portion of that data that relates to work-life balance. Also try to provide you with some information about the recent WorkWell study that I think adds a lot of value to what we know so far from the impact of work from home on work-life balance and stress among Canadians. At the end, again, we'll try to provide some recommendation and resources to help organizations and individuals to address the challenges faced by issues around working from home. Before the COVID-19 pandemic, telework as an umbrella term for work from home was conceptualized as an agreed work arrangement to support flexible workload management, and usually is undertaken by choice and agreement between worker and employer. There is no doubt that the COVID-19 pandemic has fast-tracked the work from home or remote work trend around the globe. We know that the whole concept of remote work has been in place since 1970s, and the COVID-19 pandemic has caused a rapid rise in the number of workers around the globe who now find themselves working in conditions that might be new to some of them. At the peak of the pandemic last year, we had about 5 million people in Canada that they had some work from home arrangement with their employers. In 2021, Forbes magazine stated that roughly about 74% of companies plan to permanently shift to remote work post-pandemic. The Statistic Canada suggests that 80% of teleworkers would like to continue work from home after the pandemic is over, and about 30% of the people say that they will leave their jobs if they're required to return to full-time to the office. Again, there are also some numbers around how executives at organizations project the work from home popularity and the use of work from home in their organizations, and about 70% of them say that their workforce will indeed be back in the office by the end of 2021. So we do not have the data yet to kind of see how that prediction has been happened, and also look into how a pandemic has influenced organizations and big corporations to adopt these new practices. So acknowledging that the way we work has changed significantly over the past 2 years now, despite not having complete clarity on what the change will look like, it is vital that organizations really look into the impacts that this new way of working has on their workforce, and ensure that they're equipped with the information and resources that is necessary to their workforce to remain effective and healthy. I just want to point out that work from home is not as simple as kind of right now we talk about it. There are a lot of issues, and we, through our presentation, we try to highlight some of those issues around caring responsibilities, issues around gender in the workforce, and the differences between the impact it has on different population. The research that has been conducted to date showcases a host of benefits and challenges with work from home arrangement, but the results are quite inconsistent. You see that some literature talk about increased productivity in a way of fewer break, like less sick days and stuff like that. But on the other hand, you see that there are some challenges when it comes to productivity and performance, more around problem with task completion, anxiety, and increased stress. There's some studies talking about the benefits that work from home has on creating an environment that creates less distractions for employees, increased autonomy, create greater job satisfaction, flexibility to work around life commitments, cost savings associated with commuting, and so on, and also less turnover. But then on the other hand, you see that the absenteeism goes up, presenteeism go up. There's some literature talking about reduced motivation, difficult in establishing work culture and connection between colleagues. And even there's some studies looking at innovation in some tasks and jobs that require teamwork. So despite these consistent findings, the consensus is generally that work from home can have positive effect for both the individual worker and organization, assuming that the flexibility is managed properly, the setup is appropriate for the organization, and job duties are the right fit for working outside of the traditional office. So part of a larger study that looked into the physical aspect and the impact of work from home on the workforce, we looked also into the work-life balance and the impact that work from home arrangement have on the work-life balance of workers. And also want to understand how organizations support better work-life balance for Canadian workforce. So if you participate in our previous webinars, you know that we did an initial survey back in October to December 2020, and that we distributed that across Canada. That was about 7 to 10 months after the pandemic. And during this period, we had experienced an average of over 5,000 new COVID-19 cases per day. When then we launched the follow-up survey with those participated in the initial survey, and that was done to understand how perspective and experience have changed over time. And that happened between May to July of 2021, about 6 months after the initial survey. And then we look into those that are more than 18 years old, that work from home for at least 2 days per week. And again, we did not restrict by industry or sector, so we welcomed anyone that was willing to participate in the study. What we did was we had about 1,600 participants. As you see here, this is the demographic. About half of them were aged between 36 to 55. The majority of them were female. This stayed consistent in our follow-up group as well. And we need to note that most of our respondents were from Ontario. About 37% of them were people had children, and just half lived with another adult, but not children. In the follow-up survey, again, we saw these numbers stayed relatively consistent. Job-wise, the vast majority of respondents for both surveys were non-managers and worked for large organizations. The most represented industries include education and training, professional, scientific, and technical, public administration and information, media, and telecommunication. Perhaps most importantly, about 78% of our respondents had never worked from home prior to the pandemic. So this was truly a new way of working for many of our participants. And about 84% of those participating in our follow-up survey were still in a full-time work from home arrangement during the follow-up survey. So these graphs focus on the work-life conflict aspect of our research, and they represent the within-person result from the initial and the follow-up survey. So the numbers are about 400 people that we've extracted data to kind of better understand if there is any change between the initial to follow-up survey. And as we can see here, you see that about 27%, about 1/3 of our participants suggested that job stress interferes with completing home obligation, both in the initial and follow-up survey. And about 20%, 1/5 of our respondents reported that family stress interferes with work responsibilities. And again, that has been consistent to the initial to follow-up survey. Regarding work and life conflict, 36% of people and participants in our studies agreed that the demand of the work interfere with their home and family life. And over a quarter of individuals indicated that due to work-related duties, they must make some changes to home and family plans. And again, you see that we have some relative consistent results to the initial and the follow-up survey. In our study, people with caring responsibilities, and that is, inclusive of children and other dependents, reported more work-home conflicts and more home-work conflicts compared to individuals without caring responsibilities. So definitely there is that significant impact on those that they have caring responsibilities. Managers reported greater home-family conflict than non-managers, and individuals 50 years and older reported the least conflict compared to their younger counterparts. And that could be perhaps, as a result of many factors experienced, in addition to perhaps having less children that they are on the young side, and they are less than 5. This graph also represents the within-person results from the initial follow-up survey, as I mentioned. And as you see here, with respect to satisfaction with household tasks, about 15 to 20% between initial and the follow-up survey suggested that they are not satisfied with the household tasks added to their day-to-day routine as a result of COVID-19 pandemic and work from home. In respect to childcare duties, you see that in this slide, we have some data looking at that, and you see that 15 to 20% suggested that they're not satisfied with the childcare duties added to their day-to-day routine based on work from home arrangements and the COVID-19 pandemic. This table also shows how our respondents rated their perceived work, home and home work conflicts compare to the pre-pandemic. And as you kind of see during the initial survey, 25% of our respondents suggested that work interferes with home or family life, and about 45% reported same level of interference. Then these numbers have changed slightly in the follow-up survey, but more and more you see that a much smaller number believe they had less work-home conflicts prior to the pandemic. So what that really means, and how other countries reported this data, and what is the role of caregivers and the impact it has on women, is an interesting aspect of this type of research that we see coming out from other countries. During the lockdown period of again 2020 to 2021, those working from home who were also parent were required to combine and balance the work commitment with parental responsibilities, including, as many of you perhaps have dealt with, remote schooling. There was a study in UK that they described work from home during COVID-19 lockdowns kind of as a challenge for many of the parents compared to non-parents, because they were more likely to be able to secure time to focus on work. So those that they're non-parents, perhaps they had a kind of better experience on having more time to focus on their work. With parents, particularly mothers, we found that it's challenging to find the space and time to undertake their paid work due to the additional domestic responsibilities, including housework, childcare, homeschooling, and add to this that complexity of, for instance, those parents that, or those of us that they provide unpaid care to a care recipient that is not our child. It's our parents, family and friends that they are on the aging side, and we needed to provide care to them. So the UK study reported that an increase in fathers' participation in domestic and care responsibilities, but it still is mothers that they are more impacted by the issues around work from home and the impacts it has on home to work and work to home conflicts. There was also a Canadian study that they found that while mothers continue to disproportionately carry the burden of household responsibilities and childcare, the fathers share did increase slightly during the lockdown. So it was not that that fathers were not impacted, but again, you see that again, similar to the UK study, we see that more impact on mothers. That was the same in another study in Italy, when again the woman's kind of demanded working to deal with domestic responsibilities and childcare has been increased. When it comes to, again, work-family balance, there was another kind of research that they look into younger mothers and those that they have children that they age between 0 to 5 years old. And they reported that those mothers likely reporting more difficulties with work-family balance due to domestic responsibilities. And that's kind of, again, another very interesting data to look at that. In our study, we looked into those issues as well. And in fact, a parallel study in Australia looked into those as well. Similar to our study, and the Australians found that women working from home with children reported significantly higher level of stress in comparison to men. And those that they work from home with and they have children, you see that increased level of stress it could be a result of disproportionate responsibility for household chores and caring responsibilities, which again consumes more time and attention in the lives of women, particularly again those that kind of have children. So kind of that was kind of a very brief overview of what we found in our studies. And again, just want to emphasize the complexity around this when you have the gender differences, the impact that has on different settings, and also the impact that school closures would have, the impact that the work from home has on those women and those mothers that they have children that they are within the age of 0 to 5, and you see that this is a global issue. You see that the study in UK, in Italy, there was a study in China, in Canada. They are all pointing to the same issue, as that we need to do more as organizations. Need to build more resources, more capacity to kind of build resources to help their employees if work from home or even the hybrid work becomes a new norm in future. So now I would like to hand it over to Dr. Todd to talk about a very interesting study done by YMCA Workwell group, and the findings of that study that I think was very complementary to what we found in our studies at CISWP. Just now hand it over to Kate to walk us through some of their data. Thank you.
Thank you so much, Dr. Yazdani. I'm very pleased to be here today and to share these results with you. Certainly very much in line with what you've been hearing with the National Work from Home Survey. Just a little bit about YMCA Workwell. We are a business-to-business branch of the YMCA of Three Rivers here in the Kitchener-Waterloo, Guelph, Stratford, Perth, Cambridge communities. And this survey we actually conduct annually. And so we have year-over-year data that we can share. But we had a focus in this particular survey of looking at burnout, because we're hearing about the burnout epidemic and really facing a period in time where people are more burned out than ever before. And so we really wanted to understand more about that. So our survey, we collected data between mid-September and early October 2021. And we collected this data from 1,851 participants, primarily in our catchment area, but it was available through social media. So we do have people outside of that area as well who have responded. About 73% of our participants were women. Just shy of half were frontline workers. The rest were managers, directors, leaders, entrepreneurs, et cetera. And about 58% of our sample were parents. And so all of those things play into what we see in the results, as you've just heard from Dr. Yazdani. Could I have the next slide, please? Thank you. So we asked people, how often do you believe you've experienced burnout in the past 3 months? And you can see here from the slide that the results are quite substantive. So 71% of the population are reporting burnout from sometimes to extremely often. And in this particular, these slides that you're seeing here, this is on the work from home portion of our sample. So this is a subset of 620 respondents in our wider survey. And so 7 out of 10 of your colleagues, coworkers, et cetera, are reporting that they're feeling burned out sometimes to extremely often. And a third of them, a little over a third of them, are reporting that they're feeling burned out often to extremely often. So that's really substantial when we think about the way that people are showing up to work, whether they're working virtually or in an office or workplace or some hybrid thereof. People are really exhausted and depleted right now, and we need to keep that in mind as we're thinking about how do we help support people. Next slide, please. So in this case, we wanted to know how burnout was impacting mental health. And as you would expect, the more that people are reporting being or feeling burned out, the lower their mental health scores were. And so we have our scores on a scale of 1 to 100. We consider anything below 60 to be an unhealthy score. And so in this case, you can see here that even if I'm only sometimes reporting burnout, my mental health score is borderline unhealthy. And as soon as I'm reporting that often or extremely often, I am well within that unhealthy space in terms of my mental well-being. Next slide, please. We also wanted to know about overall well-being. And so we can see that we've got a little bit of a rosier picture here, but not much. So mental health is more impacted by burnout, but it is also impacting overall well-being. Again, we're at risk at some times, and we're unhealthy as soon as we get into often or extremely often. And so this is impacting every aspect of how our employees are feeling when they are working. And so definitely one of the things that we need to keep in mind as we're thinking about how do we move forward and deal with this. Next, please. So we asked employees, what did they need in order to support their well-being? And you can see the top 5 answers here. It's interesting to see the distinctions between this from our work from home subset of our population versus our broader sample. The first 2 are the same. So better work-life balance is the #1 thing that they're asking for, and a more manageable workload being the key contributor to that. So as we think about how we can give people better work-life balance, one of the key areas that we need to be thinking about is that workload piece. And how can we make sure that the workload is manageable for our people? Because if it is a never-ending funnel of workload coming down, that's where that work-life balance and the work-life interference starts to happen. If I can't turn off the workload tap, where do I find a break? And I heard a really interesting comment relatively early on in the pandemic. And it said, we're not working from home, we're sleeping at work. And particularly not knowing what our employees' working situations might be. I have the luxury of a private office here where I can shut the door. And so that works really well for, for the most part, having a separation between when I'm working and when I'm not working. But for those who are working at the dining room table or on the living room couch, particularly as Dr. Yazdani alluded to, with small children running around, I have a son in grade 3. And so his grade 1, grade 2, and now grade 3 experiences have been impacted by this pandemic. And that has certainly impacted on my ability to work. And so some of the stories that we hear about is that, I have to help my child with remote learning during the day. So I'm working after that child goes to bed, and I'm working until midnight or 2 a.m. or whatever it may be. And I don't feel ever like I keep on top of that workload. And even when I'm not working, the thought load, the worrying about work is part of my day-to-day experience. Just being able to turn that off is very challenging for me. #3 issue, clarity around the return to work. And so we've been talking a lot with clients that we support during this time period of what does it look like? How many organizations are shifting to full remote versus some type of hybrid, which is the most common that we're seeing, versus pulling people back into the office, and what does that look like? Many of our partners were moving forward to that return to office sort of late 2021, and many of them it's now been put on hold because of Omicron. And so there's a lot of uncertainty around that, and recognizing that uncertainty causes a great deal of anxiety and stress for many people, as do lockdowns and more remote schooling periods, et cetera. So clarity, as much as you can provide around that return to work and what it's going to look like, is very helpful for employees. That ties in very much with #4, which is that clearer leadership communication. Very early on, I'd say August 2021 in the pandemic, this is one of the top things that people were calling for. They wanted to hear more from their leaders. And it really didn't matter whether it was you had something new to share or just we don't know anything else yet, and we will let you know as soon as we do. They were looking for that transparency and to hear regularly from their leaders to feel a little bit more certain about what was happening inside their organizations. So I would say the more that you can communicate, even if you feel like you don't have anything new to say, it's important that your employees hear that if you're a leader. And then #5, which was high priority for many people early on in the pandemic, remains a high priority for those who are continuing to work from home, which is around connecting with other people. In the summer, we did our survey focus on loneliness and social isolation, and we found that was also having a substantial impact on the mental and overall well-being of employees. Many people feeling that increased sense of loneliness. And so if you have been working from home over this entire period, that time to connect is so very, very important. And we're still seeing that as a clear theme in our partner organizations as they are thinking about how do we connect people in a more virtual space? And when we can get together in person, how can we prioritize that? So very important in terms of the top needs. Next, please. One of the other things that we really wanted to understand as part of our survey was around the Great Resignation. And I'm sure that you've been hearing about this in the media as well. What we found was that 32% of our work from home respondents, which is slightly lower than all respondents, had already started a new job during COVID-19. And 26%, another 26%, are seriously considering leaving in the next 6 months. So when you add that together, that's a substantial part of your organization who have either already left or are considering leaving. And we asked them why they were considering leaving. And this was a qualitative question for us. So we actually coded all of these comments. And 53% for our work from home sample said that their primary reason for either having left or for looking for a new job or seriously considering it were related to personal well-being. And that included things like feeling burnt out, lack of work-life balance, lack of work flexibility, workload, and also very importantly, feeling underappreciated. And so in this space and time where employees have been working under these extreme conditions for almost 2 years now, remembering that one of the simplest things that we can do is to show authentic appreciation for our people and how they show up each day as a key way to show that they are valued. And when I feel valued inside my organization, I'm less likely to consider leaving, and our data bears that out. Some people are also looking to leave for general life change. This could be, graduating school, moving locations, etc. And then pay, 12%. So pay is important. I'm not trying to suggest that it's not, but it is being far overshadowed by people thinking about their personal well-being. And Dr. Yazdani alluded earlier to the future of work. And we're in this space and time where people are starting to question what they want their lives to look like post-pandemic and really making some substantive life changes. And thinking about what do I want this to look like at the end of the day? And what is my organization sharing about how they prioritize my well-being as an employee? And so that is really weighing into those statistics around the Great Resignation. So what can we do? And at WorkWell, we are very much about taking insights and thinking about how we could take action, as is CISWP. And so what can we do as organizations? One of the things that we have done at our YMCA of Three Rivers is to institute employee well-being check-ins. And so this is just taking some deliberate time to connect with each employee just to see how they're doing. So not to talk about work, just to take a few minutes to check in and have an authentic conversation about how are you? What do you need? How can we support you? And having that dialogue. And so that is a great strategy to make sure that you're doing those deliberate check-ins with people and that you're not just every time you meet connecting about the work. Frequent and effective communication. We've already talked quite a bit about this. Communicate more than you think you possibly should and in more ways so that you are ensuring that employees are hearing from you. Very important to be doing that. Demonstrating a desire to address employee concerns. We are all individuals and we all have different things going on in our lives, whether it's childcare or elder care or other types of caring responsibilities that we have. Do we have sufficient equipment at home to perform our duties? Recognizing that employees are dealing with those different situations and how can you authentically support each person where they're at. Schedule flexibility. This is very helpful for people, allowing them more control about when, where, how, and what they're doing. And the more control that we can give people about this, the more that we meet their needs. Our study also looked at this idea of control over work and flexibility, and recognizing that people want to work in different ways. Dr. Yazdani shared earlier that many employees like the telework and want to continue doing this at least some portion of their week. And so allowing that flexibility and allowing people to align with what works best for them. Others can't wait to come back to the office, and some people want both. And so how can we create organizations that are flexible enough to allow employees more say and control over how, where, and when they work, in order to allow them to create the schedule that works best for them, because each situation is different and unique. Accommodate those with caring responsibilities. We talk often in the mental health field about work accommodations and natural supports. Work accommodations being those things that you have to move forward as an employee to ask for. Natural supports being those things that exist inside the way an organization is set up that any employee can access regardless of their situation. And so if we can think about building more natural supports, for example, can we accommodate flexible work times and allow people to choose an 8-hour block within a certain set of hours, allows for people to tailor their work responsibilities around their life responsibilities. And so when we can create those opportunities for all employees to access, that's a great way to support our people, regardless of the situation that they're facing. Promote maintaining a routine, work-life balance, physical activities, and scheduled breaks. And so what I really want to say about this is that if you're a leader inside an organization, what you model really matters here. You can say it's okay to take breaks and you should, get up from your desk and move around and feel free to do that. If you aren't showing that as a leader, then even though you've given permission, employees may not feel that they can step in and take that space. One of the things that my leader has done is said, get up and go for a walk at some point during the day and come back refreshed. And it's wonderful to just be able to do that at a time that works around my work schedule. And so can we model that for our employees in order for them to take those things on? The number one thing that I would say is we think about workload, because unmanageable workload is one of those top issues, is really how can we prioritize? And often we fall into those traps of everything is urgent and everything is important. But it's not possible that every task we have to do is the most important and the most urgent. So how can we prioritize, whether that's personally in our own workloads or if we're leaders for our staff? And so really being clear about what the priorities are, allow people to balance work and life a little bit more. They know at the end of the day, did they work on the most important thing or things for that day? We've already talked a little bit about creating that culture of authentic appreciation. So very important in terms of our people feeling valued and like they matter and that our organizations care about us. All right, personal strategies. So you may not be a leader. So how can you help your own work-life balance if you don't have that management authority to decide exactly how work gets done? Being able to have conversations with your supervisor and your team to be able to discuss priorities is a great way to start. So how can we prioritize what it is that I'm going to do today or this week or this month? Setting healthy boundaries as much as possible. These are my working hours. And when I'm outside of those working hours, I'm focused on my life responsibilities. And so I'm going to turn off my Teams notifications, for example, for that period of time. And I'll respond to emails only if they're actually urgent. Otherwise, they can wait until I'm next working. Focusing on your own well-being and self-care. We very much stress that burnout is an organizational issue. It is not an employee issue. And so we don't think that self-care is that, cure-all. And if you just focused on that, you wouldn't be burned out anymore. That's not reality. We need to look at upstream efforts, But for individuals, it can help us to make sure that we're taking care of ourselves. We can't pour out of an empty vessel. And so if we aren't taking time for self-care, if we're not well ourselves, we can't take care of our jobs or anybody else around us. And so just to sort of cap this off, setting a schedule for yourself is very important. Do the same things every day that you would do when you were going to the office. I love that the commute to work idea, where instead of the drive that I would have done formally, can I go out and get a walk to break up my day? Can I schedule my time in a way that works well for my life? Respect my limits. What can I and can I not accomplish within a particular day? And then that right to disconnect from work after hours. Hopefully you can, you have an office door that you can shut and walk away. But if you don't, if you're working at your dining room table or on your living room sofa, have a space to put your work away instead of leaving it out where you can see it. It's a psychological reminder that we should be working. And so being able to put that away and say, this is the end of my day is very helpful. Disconnecting your work devices, turn off your Teams notifications, etc. And plan post-workday activities that you enjoy. Continue to be as active as you can be. Take a walk, do some yoga, whatever works best for you. And then that implement the healthy lifestyle. So very important, make sure you're focusing on your sleep, eating in a healthy manner, being active, key ways to support your own well-being and your work-life balance. All right, I think we're at the discussion period now. So I'm going to turn it back over to Corey, and she's going to share some questions with us. Thank you.
Okay, thank you, Drs. Yazdani and Toth, for such a great presentation. Thank you to those of you who also submitted questions for the speakers. The Q&A box is still open, so if you do have questions, please submit them throughout this period. Just to get started, we do have a question that is curious about what future research in this area should specifically focus on.
Thanks, Corey. Maybe I start this and then Kate, please feel to jump in here. I think what the problem is right now is not understanding or lack of research, longitudinal research around the impact of work from home that it has reasons or causes that is a consequence of lockdown restrictions versus the normal consequences of work from home. So I think what we need to do more is about identifying the impact of work from home and the consequence of lockdown restrictions, such as childcare and school closure, and then see if they change when people are able to make choices about the location of their work. So kind of this longitudinal study understanding of what drives these numbers, what drives the numbers we're seeing in terms of women being more impacted than men when it comes to work from home, the issues around those that they have caring responsibilities and the impact that work from home has on those, and then see kind of rather than being a mandatory work from home setting, you are in a voluntary setting to have that flexibility to choose your location of work, and see kind of, for instance, if we see the same trend or the numbers we're seeing right now is because of childcare or school closure and activities associated with that. Kate, do you have anything else to add here?
Yeah, I would say our next survey, which will launch in the spring, is going to delve more deeply into workload. And so we are going to be taking a look at what organizations should do around workload and what employees feel that they need there. So that's where we're going to be going next in terms of our research, to try to understand how we can help support organizations in creating healthier workspaces and healthier organizational culture.
And just I want to add to this, that it is not about work-life balance alone. It just the physical aspect, the physical health aspect of this, the mental health aspect of work from home, and also productivity and performance. We did a lot of stuff on around that productivity and performance as well, to kind of even create that business case for our leaders to really understand what is the impact of their policies, of the practices in place to kind of accommodate their workers when even they return to a more a traditional way, or they utilize hybrid approach, or they use that flexible work from home arrangement, whatever it is. I think we need to better understand kind of the broader impact that it has on the workforce.
Okay, thank you. And we do have one more question here as well. They were asking if you think that organizations should or would potentially have to develop specific strategies to address caregiving responsibilities of an organization's employees. So specifically speaking about those who provide unpaid care to an elderly parent or a family member or friend.
Yeah, it's a very interesting question. I think again, we're having an aging population in Canada, and again, it's a global concern, and we see what is happening right now with the surge in capacity of long-term care and the issues around that. A lot of families now, because of many reasons, some traditionally, they are providing these unpaid care, and that has a significant burden on workers and consequently on organizations. In 2017, I think was that when in collaboration with CSA, we launched the Care Inclusive and Accommodating Organization Standard that provides some recommendations and guidelines around implementing organizational strategies to help the employees that they have caring responsibilities. But I believe sooner or late we have to get through that, and we have to make sure that organizations have in place strategies to support those employees. And we did a lot of literature looking at the mental health impact of that, and a lot of organizations that they're impacted by productivity loss, performance loss as a result of the workload that these individuals have at home and at work, and in making that balance. So I would say definitely, and there are some organizations that they have been trying to implement some strategies, but I think this is where we have to go. The organizations really need to take that extra step to ensure that the workforce is protected and they have resources in place to support them.
Just to add to that, I would say that, remember, based on our conversation that we've been having today, that those who are in caring roles are disproportionately women. And so, especially for those who are providing both, caring responsibilities to non-children and those who are parenting as well, and you've got that whole sandwich generation that's doing both at the same time, the more that we can support those individuals, the better off our organizations will be, and the more inclusive and equitable and diverse our organizations will be. So there's a strong link to the EDI work that many organizations are trying to do now as well, in terms of supporting their employees wherever they might be. And so the more that we can lean into those natural supports, where I don't have to come in and say to my supervisor, can I please have an accommodation to take my parent to the doctor every second Thursday at 3 p.m. I can flex my work day to work around that. The more positively our organizations are going to be perceived to be, the more supportive they're going to be perceived to be. And so when we think about wanting to support women in the workforce and allow them to work in full-time roles, et cetera, whereas many carers need to either choose between full-time and fulfilling those caring responsibilities. There's a lot of work to be done there to help support those in caregiving roles.
Absolutely. I just want to add another point here. I think it's not only about the work-life balance, but again, we want organizations to have that holistic approach when it comes to health, safety, and well-being of the workforce and implement strategies across the board to support all employees, but then again, with a special attention to those scenarios that you have caring responsibilities, and then again, paying attention to also the gender differences and the issues that again specific employees might face during their employment cycle with organizations.
Okay, perfect. And we do have one more question that just came in. They were wondering your thoughts on the expectations of employees with or without children. Do you think that it varies between these individuals, or do you think there should be a standard set for everyone?
Yeah, this is a very interesting and tough question. I think it's more is less around expectation than it is about accommodation. I think we should, as organization, kind of try to implement strategies to support the workforce and be more inclusive and be more accommodative. We have to kind of improve the organization culture in a way that management and labor kind of have this common understanding of the challenges that employees have. Again, there's some specific accommodation that you should put in place on a case-by-case basis, and there's some organizational strategies that need to be implemented. I would respond to this in a different way. I would say that we have to think about kind of using a worker-centric approach in ensuring that the needs of employees are addressed, in addition to kind of a broader policies and practices that organizations might implement.
Yeah, I would just very much agree with that certainly it's about creating that culture that meets each employee's needs wherever it is that they're at. And yes, there are very specific demands in terms of parental responsibilities, et cetera. But the more that we can create that supportive culture where, regardless of what is going on in my life, whether I'm a parent or whether I really like to get my gym workout in first thing in the morning, or see a child off to school, doesn't really matter when we're thinking about supporting that work-life balance and allowing our employees to be their best and most productive when they're with us. When we create that kind of bond between organization and employees, then we see engagement and productivity and retention, et cetera, go up because they feel the organization actually sees them as a person, as a holistic person with a life outside of work. And so the more that we can create those organizational cultures, the more that the organization benefits as a whole.
That's great. Thank you for those answers. So we are just reaching the end of our time for this webinar. So I'll just wrap up by saying that if you have happened to miss one of CISWP's webinars, or you can't make it to one of them, you can find all of our webinar recordings on our YouTube channel. So that is at CISWP. And we have all of the recordings from the Work From Home series as well on there if you have missed one of those. And then you can also follow our other social media channels, which includes Twitter and LinkedIn, to receive any updates or hear about future webinar schedules. So I just want to say thank you again to everyone for taking your time to join us today. We hope to see you at our future webinars, and we hope that you have a great rest of your day. Thank you.